brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, everybody, welcome back to Healthy Living Tuesday. Dr. Jitka Lom from Express Care is here, and we are talking about a very sensitive, and I stress that word both literally and figuratively, because we are talking about carpal tunnel syndrome. I, being a computer guy, Dr. Lom, there were portions in my life when I was in college, I would literally spend like 14, 15 hours a day on a computer, and kind of like towards the tail end of the 90s, people started hearing about carpal tunnel syndrome. Can you maybe give us a little bit of a brief history about it and when we became aware of it?
Sure. You know, our wrists aren't made to type on a computer 14 hours a day, but that's not the only way you can get carpal tunnel. First of all, what is it? Here in your wrist, you have several nerves that travel through, and one of them is the median nerve. It travels from your neck, down your arm, and through this little area in your wrist. It's called carpal because these bones of your wrist are called the carpal bones. And there's a little tunnel, an area where the nerve travels through, and it supplies your hands. And it allows you to move your thumb like this. It allows you to grip properly, and gives you some of the motions that you use when you're typing. And so when people keep having repetitive injury, meaning typing or gripping, squeezing things over and over, they can develop overuse of the wrist and some tightening and pressure on that nerve. And when the nerve is pinched, it'll start to hurt, especially people will start to get numbness and tingling in the hand sometimes, and weakness. And then the pressure needs to be relieved one way or another.
Mm-hmm. And the extreme form of that would be surgery,
yeah.
But can you treat it with like maybe over-the-counter medications or even with aspirin?
You can.
Or things?
First of all, if you understand what's happening, that there's basically swelling in this area, you can try to reduce that. One way we do that is by wearing a splint so that the wrist isn't bent, compressing it even more. Mm-hmm. Wear a splint like this to keep the hand sort of even with the forearm. And that is a splint you can buy at a regular pharmacy or medical supply shop. Mm-hmm. And so you wear the splint, you apply ice. You can take Motrin or other anti-inflammatory medicine to help you, and you could have a steroid injection to try to decompress the nerve, and or to try to at least relieve the swelling around the nerve. Mm-hmm. And if all that doesn't work, then they have to cut the little sheath so that the nerve can be released.
So just to be sure, it's repetitive motion, not necessarily like, for people that use maybe like cash registers or things where their wrists are positioned like that for 8 hours a day or extremely punched over.
It's both of those. It can be repetitive. There's actually a separate condition called just repetitive strain, but that just gives you pain, not the numbness, tingling, and weakness. And then carpal tunnel can be from typing, using the mouse all the time, from leaning, from cash registers, from all of the things that we do to overuse our wrists. Mm-hmm. But it can also be from other conditions such as pregnancy or thyroid problems or other injuries of if you fall and break your wrist, other things that can pinch your nerve. With pregnancy and hypothyroidism or extreme weight gain, people will just have too much fluid and fat pressing on the nerve.
Did not know that.
Yeah.
That's pretty interesting. Okay.
It's quite common. In the third trimester of pregnancy, women will start to have a lot of pain and tingling and numbness in their hands. And once they give birth, of course, that will go away.
Now, maybe something that's a little bit more familiar, because people I know that have suffered from CTS, they say you don't really realize how many things you do in your life with your wrist until you have it, because it's extremely painful. It's almost like a shocking shooting pain constantly. But the closest thing I can think of is people who have suffered from tennis elbow.
Yes.
And maybe from playing. Although that is in a different part of
it is, and it's a little different because it's a muscle, the end of a muscle that's sore and sensitive, and this is a pinched nerve, but similar. Anyway, so what can happen with the carpal tunnel is basically that people will start waking up at night with a lot of pain, because at night we tend to sleep like this. Our wrists are bent and we're compressing the nerve even more, plus our circulation isn't as good at night, so it'll swell and people wake up and start shaking their hands because there's a lot of pain and numbness and tingling. Mm-hmm.
So let's talk remedies. What are some things that people could do, like around here, like around the office? Are those gel-based silicone?
That does really help, to proper posture and proper protection of the wrist, so avoiding the bumping of the wrist on a hard surface, and that's for the repetitive strain. And then for carpal tunnel, the other thing that will really help is just limiting the activities that aggravate that. And one of them is a lot of squeezing, because when you do that, you'll tend to be using the muscles a lot there and get them swollen and strained as well. So trying to avoid those movements, which is sometimes very hard in our modern lives.
That's kind of interesting because you get all those extra pieces of exercise equipment that actually like promote squeezing, or they say squeeze a tennis ball to do stress relief. Ironically, you may actually wind up stressing out your wrist.
Yeah, that's true.
Okay, well, we got a lot of questions coming up, so sit tight, and you sit tight out there in TV land, because the good